how does one deal with bloating and PCOS? I think that, Ray, would you say that there's PCOS is an inflammatory disorder? There's a lot of inflammatory components to it. So they're still studying what's going on, and there's multiple theories of how you can get PCOS. One is genetics, one is the insulin receptor, one is just an inflammatory process, like a milieu. So if you look at your diet and what's causing that inflammation, I always tell my patients to keep a journal because it's really hard to pinpoint. Endo's really looked at patients who have endometriosis, which is another inflammatory disorder. There's actually like an endo diet. So anything inflammatory like coffee and chocolate and sometimes carbs can cause that. You see an overlap in that. So inflammatory foods tend to cause irritable bowel or inflammation, and you see a strong correlation because PCOS is tied into that insulin and that spike. So keep a diary or a log. If you eat something and you notice right away that inflammation, just keep a log of it and see if there's a pattern. Are you getting it at a certain time? Are you getting it associated with a diet? Are you getting it if you haven't had a period in 3 months? And that way you can adjust it, because truly there's so many components to PCOS, and I wish it was just simple as, oh, cut this out and it'll get better, but it's not. Everyone presents very differently. I have a very different presentation. I know if I eat rice, especially at night, the next day I'll feel fine because I'm younger, right? Like when I was younger, it's gotten worse than when I was younger, but I'm still to the point where I can handle it. But I do notice that my pants are a little bit snugger and I just feel bloated and I feel gross, for the lack of a better term. But I would say that's how I handle it. I know anything.
Yeah, I mean, I have all those things. I also will often recommend a nutrition consult for patients, and I think that that's also helpful to kind of go over the diary and things that they're eating with them too.
For sure. This is one of my favorite topics. What is the relationship between PCOS and AMH, and what do high AMH levels mean for somebody who has PCOS? So AMH, I know, and I spoke about this earlier, stands for anti-Mullerian hormone, and it's secreted by the surrounding cells of an egg. So the higher your AMH, the higher your egg count. So I tell my patients, think of your AMH as your 401k. That's how many eggs you have in your bank, right? Mm-hmm. And PCOS, because there's that signaling defect, they don't go through that follicular recruitment and triage, meaning getting rid of, that normal biology female should. So every month, female should recruit 90 to 100 eggs, and then you lose them, and the next batch comes up. Something with PCOS, there's that signal problem that Anu was talking about earlier, so it's not happening. So for me, the first part is working, where they're recruiting, and then they sit there, and then they recruit, and then they sit there. So patients with PCOS, because of that signaling defect, tend to accumulate a lot of active eggs, which then will correlate to a higher AMH. Okay, but right now it's not the diagnostic criteria for PCOS. So it's a one-way relationship. PCOS patients tend to have a higher AMH, but a high AMH does not correlate to PCOS. It does not mean you have PCOS. I beg to differ, but I'm not in a position where I can say high AMH means you have PCOS, but I definitely do treat my patients with a high AMH like PCOS, because when you dig deeper, you do find out that they have other signs and symptoms that correlate to PCOS. These patients tend to be anovulatory, or have varying degree cycle lengths, or have high testosterone or clinical signs of hyperandrogenism. So for me, high AMH does mean PCOS, but it's not a textbook definition. I think you would have to ask your RE how they feel about it.
I agree. I think they often kind of go hand in hand, but not always, associated with each other. So,
yeah. And then other that sugar and high GI foods, what should be avoided? Anything that causes upset. So for me, and I talked about this earlier, Mediterranean diet is really good for fertility. So if you're trying to conceive and you're looking to what's good for you, that's what I would say. But there's not necessarily, for PCOS, it's mostly insulin. If you believe in that insulin theory, it's insulin driven. So I say anything that spikes your insulin, right? So you want to eat foods that are lower on the glycemic index, so more complex carbs, more fruits, more vegetables, higher protein than carb content. Not necessarily like a ketogenic diet, but still a good balanced diet. Would you agree?
I agree. That's a good summary.
And so do you want to read the last one?
So does PCOS and high AMH mean you have a good amount of egg reserve left? So AMH is, standardly used to, like the textbook definition, is more to predict a patient's response to treatment, not necessarily to tell us about necessarily like egg reserve or number of eggs remaining. However, having said that, it's our best tool to interpret this type of information. So generally speaking, a high AMH does correlate to a better ovarian reserve, and in theory, like higher egg number and egg quality. So
yeah, and it's I would also say that just because you have a high AMH doesn't mean you have a good quantity, but it doesn't reflect quality. So AMH is not a predictor of quality, it's only a predictor of quantity. If that, like what Anu said, it's typically used for high use stim. There's a study that showed that patients who have a lower AMH had a quicker age to menopause, but that's also a newer study, and it's not something like textbook that we follow.
Is pain during periods a part of PCOS despite taking the pill and weight loss if pain still persists? So I usually, so with PCOS, typically they're not ovulating, and so they're usually, not always, but they can be not having pain actually when they bleed. And so in some ways it's reassuring when patients have pain with periods. It can be reassuring that a patient's ovulating, but still the cycle frequency is important. So I would say most PCOS patients may not have pain when they bleed, but again, that's not necessarily across the board. Would you add anything to that, Roohi?
No, I would say if you're having pain, pain is not normal ever, right? So I would get it checked out. I wouldn't be dismissive of it and say I have PCOS. It's because of that. So if you're having pain, you want to make sure that one, it's being addressed, and two, that it's not something abnormal. But no, you should, like Anu said, if you're PCOS, you typically don't have pain because you don't ovulate. It's an anovulatory bleed, and then you should not have pain when you're on birth control pills. I'm assuming that's what they mean by pills because it's anovulatory. So I would definitely, that merits the workup and figure out what's causing your pain.
I agree.
And then non-organic dairy has anything to do with getting PCOS. So PCOS it's multifactorial, and it's not linked to one specific thing. Mostly you see it in patients who have a strong family history of metabolic syndrome. And I don't think it's been linked to one specific food group. Would you agree?
Yeah, I would agree. Mm-hmm.
Okay. But yeah, good question.
Is it hard to lose weight when you have PCOS? I've been working out hard for the last 2 months, the clean diet and intermittent fasting, but not lost any weight. Starting to get weight loss, I think across the board is a hard thing. I've struggled with it myself too. And I often will send patients to a nutritionist and these type of things to help. But it's a struggle. I wouldn't say necessarily PCOS patients are more challenging than somebody else. I think as we get older, our metabolism slows down, and it just in general becomes harder. And so, but yeah, that would be what I would say. How about you, Roohi?
Yeah, I agree. I looked into this because I have like central mid, right? It's the Daisy thing that used to get hips and stomach, especially after kids. So I looked into seeing, was this linked to PCOS, that I'm accumulating it because it goes with metabolic syndrome. So I don't think everyone who has PCOS has metabolic syndrome, but like Anu said, as you get older, your metabolism tends to slow down. I think sometimes we think, and I know I did, I would look and I'd say, well, I'm working out so hard and it's not working, but really breaking down what's working out for you. And if you're truly working out how, like, having metrics is important, because I'd be very honest, and you guys could all laugh at me. My very first time when I was going through fertility, they're like, oh, you need to work out, your A1C's high. I bought the Wii and I started doing Zumba on it. And I was like, oh yeah, look at me, I'm working out. It's not working. And my husband, who's actually like really big into fitness, he's like, you're doing Zumba on the Wii. He's like, you're really not even breaking a sweat. And I was like, okay. And it was frustrating because I was like, but I'm working out. What do you mean? So I think, like Anu said, having somebody externally assessing your workouts to see if you're actually meeting your metrics. Are you burning more calories than you're putting in? Getting a nutritionist to see, have you truly adjusted your diet? Because I would not eat all day and I'd be like, well, I didn't eat. And then I would binge eat, like eat a whole plate of rice and, like Indian food on it. And it'd be like a layer of everything and low protein and high carb. And I'd be like, well, my calories are really low and I can eat that. But it's not, because PCOS is really hard to manage and hard to understand. Even as a doctor, it's so hard to understand that I think having people who specialize in all of these can prevent that disappointment that you're starting to feel. And another thing I learned is measure it by how you feel internally and how your insides are improving, because your weight loss may not signify your what you're investing in it, but if your heart's getting healthier and you're living longer and you don't have prediabetes, that means the world, right? So aesthetics will follow. Believe it or not, aesthetics are the last thing to come, but your improvement and how you feel inside and your longevity is what's gained. And probably in the long term, that's worth its weight in gold over aesthetics, right?
I totally agree. Yeah. And just thinking when I was in a particular time where I was really struggling with weight, so I was, working out and thinking like I'm eating well and nothing's coming off. And I actually joined Jenny Craig, and they have those counselors and everything like that. So, not accounting for, the little snack I had here or the glass of wine at night I had here, like, calories do add up. And so I think also keeping a food log and really keeping yourself accountable for, everything you're intaking is something that's good. And it really also, keeps you accountable. And the counselor, so I was doing a little bit of working out, and after, I don't know, like a month or something of talking to her, I had this gym membership. I was going 5 days a week. I was doing this insane weightlifting, I forget, body pump, whatever you call it. But yeah, I took it to a whole another level. And so that encouragement and that, accountability, that push that she gave me was also really helpful. And then I did start to see more results. So I'm always an advocate for those type of programs. I think they are good to kind of keep with you as you're going through it and help push you.
Sure. Can you talk about facial growth associated with PCOS and hirsutism versus PCOS? So PCOS has a strong tie to hirsutism. One of the criteria, like Anu mentioned, is clinical or biochemical signs of hyperandrogenism. Hyperandrogenism means high testosterone, and that can cause acne or hairiness. And you tend to have more male pattern hairiness, so hair on your chin, thicker hair on your upper lip, hair on your knuckle, hair in between your breast or around your nipple, which females should never get, and different pattern of hair growth for your pubic hair. And how you take care of that is by managing your PCOS, so controlling your hyperandrogenism, so suppressing that with birth control pill. And certain birth control pills are better for you than others because they're less androgenic, meaning less testosterone derivatives, and making sure that if you're more looking at it more from an aesthetic perspective, you can do waxing, lasers, there's creams out there. I personally am on spironolactone, which is an anti-androgen. It's commonly known for its blood pressure effects, but I take it for my hairiness. I do have a lot of hair that's like literally everywhere. My husband teases and he calls me a baby bear, and like my kids when they were born like fur balls. But it's from one, being Indian, and two, PCOS. Like my sister and my mom, like growing up when I was a teenager, I still remember I was so scared because my mom and my sister never shaved, and I was going to gym, like PE, and I had to wear shorts in middle school. And I could not get the courage to ask my mom to shave my legs because my sister and my mom never had to shave their legs. They're just not hairy. They're at all. And I was this like really pale yellow girl with really dark hair, like everywhere. And I snuck in like my dad's shaver and I like literally tried shaving without telling them. And I like cut myself everywhere and started bleeding. And I still remember I was like, I'll never shave. God, please don't let my mom find out. But it's important to address this kind of stuff because not everyone presents the same, but you want to, if it's bothering you, want to take care of it. And there's creams, there's lasers, there's more permanent, there's more middle, right?
Yeah.
I do.
Yeah, I think that's a great summary. There's certain, you basically touched on it, but there's a certain scaling system that we use to measure the hair growth, and it's called the Fairman-Galloway scoring system. But basically, it goes over these 9 different areas where the hair can be increased in growth, and basically putting the patients, giving them a score, and that would determine if they had it or not. So, but there's a lot of ethnic variation and that type of thing involved too. So it can be a hard thing sometimes in certain ethnic backgrounds.
Yeah.
I think that's it.
I think we're good. Thank you guys so much for listening. I know this is a very big topic to conquer, and it's something that we secretly all, I think there's a component of everyone that touches on PCOS. I personally think everyone has like with being South Asian, but that's just my biased opinion.
Somebody asked another question. Does PCOS get worse as you get older? I guess what symptom or what aspect of it is what I would ask.
Yeah, so I think if you're talking about what Anya was talking about earlier, the metabolic component of it, yes, it tends to get worse as you get older. But if you're talking about the fertility aspect of it, actually there's a really good paper, 2017, that showed that patients who have PCOS have an accelerated timeline to menopause. So you think that, oh, I have PCOS, I have a lot of eggs, that I'm never going to hit menopause or my fertility timeline is extended. And I don't think that doctor's on here. She's also a South Asian doctor, but she did a study and she looked at the time to menopause with higher AMH and PCO patients, and you still hit menopause at the same time. So whoever's telling you, and I know a lot of my fertility doctors would, you see and you're like, oh, you can have babies forever. In my head, that was like the worst thing to hear because I was like, well, I can't even have one, forget forever. But yeah, so your time to menopause is the same. If it's another thing, but I think it depends what component of PCOS you're talking about, right?
Yeah, I agree. Any particular exercises you recommend, Roohi? I can't think of anything in particular, but I feel like you know more about this.
Yeah, I like HIIT workouts better for PCO patients. I think because there's such a strong metabolic component to it, so tricking your metabolic system, that's what I call it, works well. So stuff like intermittent fasting, giving your body a break and allowing it to kick in. HIIT also plays on that, trading off between aerobic and anaerobic. Earlier when there was that question saying I've done everything, that really worked for me because I felt the same. I was like, well, I ran and I did this and I did X, but I'm not getting that same results as other people are. But until I started doing like Orange Theory really worked for me because it's huge metabolism. That's what it plays on. So it fluctuates your heart rate and the type of workouts that you do to really, that's when I noticed the biggest difference. And that was when I was finally able to bring my A1C down to that level. And it's really just playing on that metabolic component and that theory of it. Orange Theory is very new, so I don't know how many studies or anything that's done with it. I think I should work on that. I know that should be next. But I personally think that really works well. So alternating and kind of tricking your body between aerobic and anaerobic. I think when I did IVF, I know we said earlier, I worked out, and there's a risk of torsion, but I didn't do HIIT stuff. So I did, and because just not to lose the habit, I did incline walking, very slow and steady. I did more upper body so I wouldn't be straining my abdomen and my core to prevent torsion. So I think just habit of working out is also really important because I hate working out. So I really have to push myself to work out so I can't lose that habit. So I think one, get in that habit, and two, HIIT workouts worked for me.
Yeah. I think COVID has also made it so hard to keep the routine up. I was also trying to exercise, on a regular basis, and it's been a lot harder. So, how are you keeping, you're doing home workouts, or how are you?
I'm doing home workouts. Yeah. It was so hard for me to tell Orange Theory I'm not coming back because I loved it. But I am doing home workouts. I did get suckered into buying a Peloton. It didn't arrive yet, so I'll let you guys know how that goes. But I do. We literally built like an entire home gym just to see, but it's not the same. I can't push myself. I get very distracted, and I go play on my Instagram, and then my kid pops in. So
yeah, I've been struggling too. I've been trying to run on the weekends at the least, and it's just not the same. It's just not the same, amount of time and everything. So I need to consider getting a Peloton. I considered an elliptical. I haven't broken down to the Peloton yet.
Do it.
I'm not a bike person, so I just don't know if it's going to suit me. I'm usually an elliptical person, so I don't know.
Well, we have one more question. I was diagnosed with PCOS at 16, but I have regular periods since I was 18. However, missed 1 or 2 periods over stress. I'm 28. Last time I missed, it was at the start of COVID. Oh, so PCOS doesn't necessarily remember. There's different criteria for it. So I have regular cycles, but I have really bad PCOS. So it's 3. You have to have 2 of the 3. So it's anovulation, or so irregular cycles or no cycles, clinical or biochemical signs of hyperandrogenism, so meaning hairiness or acne or high testosterone in your blood, and then multifollicular or enlarged ovaries. So even if you have regular cycles and you have the other 2, you still have PCOS. So you can have normal cycles and still have PCOS. And I had irregular cycles when I was younger, but as I've gotten older, they've started to regulate.
I would just also add, when periods start, there is that whole communication system between the brain, the ovary, the uterus, and that system is just learning how to, regulate itself. So it's actually normal to have irregular cycles for the first year or 2 after starting your period. But after 2 years, if it normalizes, then that can be normal. It's just that, access really learning how to work for the first couple of years. So, great.
All right. Thank you guys so much. Do you have
I was just going to say, do you want to end with saying our social media handles?
Yeah.
Okay. So I'm Anu Kathiresan, and I am at Anu Kathiresan MD on Instagram.
I'm Roohi Jeelani, and I'm at Roohi Jeelani MD on Instagram. And I share a lot of my PCOS journey, and Anu does really cool TikTok videos. I love watching, but they're very easy to follow, and I enjoy them as a fertility doctor, so I'm sure all of you guys will too.
Thank you. I enjoy the hip hop music. I try to do a little education with it. So
it's great. It keeps my attention.
Oh, thank you.